presentation. Our second presenter is Evan Pliss. Evan is a senior instructor of psychiatry and licensed clinical psychologist at the University of Colorado School of Medicine. His research and clinical interest focus on the quality of care in residential, post-acute, and long-term care settings, family caregiving for persons living with dementia, and technology-based behavioral interventions for older adults and their care partners. So Evan, I'll turn it over to you. Thank you.
Thank you so much for having me. I'm feeling really grateful to be here and grateful to the Parkinson Association of the Rockies for having me, and also to all of you for somehow finding a way to carve out time on a Saturday to join us and to give your attention to us. So just filled with a lot of gratitude today. So thank you again for having me. Hop in and start with an exercise. So I want everyone with your paper or in a Word document to think about who is the model for a good family care partner. This can be someone who you've seen in the media, a character in a movie or a television show, or someone you've met in your own life. But just take a couple seconds and think about who your model of a good family care partner is, and write that person's name down. Okay. And now I want you to think about why you chose that person as your image of the model care partner. And we're actually going to take a minute or two, and I want you to list some of the characteristics of that person and why you think they're really the model image of a family care partner. And I guess more generally, what are the characteristics of a family member who's a really good care partner? So it'll take about 30 more seconds. Okay, and so I'm curious if anybody is willing to share with the group about what they wrote down. What are some of those characteristics specifically of a good care partner? Or you could write it in the chat, although I don't believe I'm able to see the chat. Oh, yes, I can. So what did you guys write? Sense of humor.
I wrote that she was there when I needed her and not there when I didn't need her or didn't want her there.
Yeah, and I'm seeing in the chat a lot of patience and being loving, devoted, understanding, caring, compassionate.
I was thinking of listening well.
Listens well, yeah. Seeing resilient a couple of times. So these are great. These are great characteristics, and to some of the themes I'm seeing here are kind of people who can regulate themselves pretty well. Have that sense of humor, have some resilience. Not get too overwhelmed by things, and then also this theme of continuing to be loving and patient and persevere and caring, really selfless sometimes and positive, and those are really good characteristics of a care partner. And so we're actually going to come back to this in a little bit, but I think that's a really great and comprehensive list. So we're actually going to hop right into another exercise. And I want you to imagine that you have a friend and their friend is caring for a spouse who is diagnosed with Parkinson's. And your friend connects the two of you. This is an acquaintance, someone maybe you've met in passing here and there. And they really open up to you and they tell you that they're really frustrated, they're feeling really overwhelmed, they're at their wits' end, and the things that weren't really bothering them before are really starting to get to them, to get on their nerves. Things like soft speech or apathy. They tell you a story the other day that their spouse stood up and was really unbalanced and almost fell, and they were really angry and they yelled at them. And they just said they're having a really hard time being nice. They're really stressed, overwhelmed, and building up resentment. They're feeling guilty about that resentment. And they go to you for advice. And so I'm curious, and if you could, we could take a couple of minutes to write down, how would you typically respond to this person? And so, depending on the day, you might respond differently, but just in general, how might you respond? What would you do? What would you say? What would be the tone in which you would say that to this person? Why don't you take a minute and write down what your response would be to this person as they're telling you how overwhelmed they're feeling. So I'm seeing a lot of really compassionate responses in the chat, validating the experience, saying, I understand what's going on. It's really hard. Some advice, smiling, being positive. Yeah. So now I want you to think about you're that person who's feeling really stressed and overwhelmed, and you're feeling in a similar space where you notice that your tank is low, you're really maybe more irritable than normal, you're having less patience, you're building up some resentment, you're feeling guilty about yourself. And I want you to now write down how you typically would respond to yourself in these situations. So just like before, write down what you would do, what you would say to yourself, what are the self-talk that's going on, the tone in which you would respond to yourself when you're the one who's really experiencing this stress and negative emotions and just feeling pretty overwhelmed. So some mixed, I'm seeing on the one hand, there's some people who are saying like, okay, I need to take a deep breath, take care of myself, and other ones are saying, why can't I do this? You need to do blank, blank, blank. In general, not seeing a lot of the same validation in that first one. And I'm curious if anybody would be brave enough to, in looking at how you would respond to the acquaintance versus how you would respond to yourself, anybody see any differences, or anyone want to share what they notice, if they did observe any differences between the way you respond to those in those two scenarios?
Maybe it's because I'm a nurse, but I was thinking I would normally tell somebody else something different than what I would tell myself.
Yeah,
But
nurses are notorious for that.
yes, but I would also think I need to be speaking more gently. I tend to get angry or irritated and show it when I'm at the end of my rope. Otherwise, I can remember that I'm not alone. The Lord is always with me, and He helps me to be who I want to be.
Yeah, and so it's and sometimes a little bit easier, and in the chat as well, people are saying it's easier to express that to other people than it is to yourself sometimes. And you might be able to say, well, I know I need to take care of myself, but and some people in the chat are saying there's a bit of a sense of immediacy, and sometimes it just feels harder to do that. And I want to pose to the group kind of a question just to mull over in the next couple of days. What would change in your life? What would be different if you truly did respond to yourself the same way that you would a friend or a contact, even a stranger who were coming to you about a difficult situation? And what would that look like? And that exact concept of really treating ourselves in that same way, with that same empathy and compassion, is a term called self-compassion. And there's a psychologist in Texas who really has done the bulk of the work in this area. And I think it's really important, and I was struck by really similar themes in Carrie's presentation around increasing self-compassion for ourselves as care partners. And so this psychologist in Texas defines self-compassion really through these three domains. So there's self-kindness, and what that's really getting at is approaching ourselves with understanding rather than this hypercritical, judgmental voice that a lot of times is pretty available when we're evaluating ourselves. And so going back to the scenario on the previous page, a lot of people express understanding. I understand why you're feeling this way, to the acquaintance. And do we do that for ourselves? Are we being kind in the same way to our own situations and our own emotions as we are to strangers? The other, another component is common humanity. And I think that this component of self-compassion is, I call this like the colloquialism component. This is like all of the adages kind of fall into this category. We're all human, everyone makes mistakes, we all need help. Actually, I was I was on the chat previously before we started this morning, and I'm going to call out, I think it was Bonnie and Alan were talking and actually said, well, we're all human, which is this component of self-compassion. When we put that into action for ourselves, that's really being compassionate towards ourselves like we would another person. And the last component of self-compassion is mindfulness. And mindfulness is really just being completely present in the here and now and really engage with our surroundings. And one of the reasons why that's an important component of this broader self-compassion is when we're really centered and when we're really present in the here and now, it's hard for us to access some of those negative thoughts that can create this pattern. Thoughts about ruminating over the past, thoughts about worrying about the future. A lot harder to do that when we're really, really focused on the present than when we allow our mind to wander. So that's a really important part of this self-compassion, self-care. And if you look at these three domains, self-compassion really encompasses a lot of how we talk to ourselves, the thoughts that we have about ourselves, the emotions and how we deal with our own emotions. It's a very emotional, cognitive concept. And I would say a parallel concept to self-compassion is self-care. And whereas self-compassion is a lot about the thoughts that we have for ourselves, those emotions, self-care is more about the behaviors that we actually do for ourselves. So things like relaxing, taking a bath, exercising, engaging in hobbies, these are self-care behaviors that are equally as important as self-compassion for our well-being. And you might be asking, why is there a frog on this screen? We have a depository of publicly available images, and I typed in relaxation, and literally like the first 5 images were ceramic frogs. And it was really easy to find frogs engaging in self-care behaviors. Actually a lot harder to find humans engaging in self-care behavior. So I take that for what it's worth. But I guess if there's a take home today, it's be more like the frog in your everyday life. So I don't think it's going to be a surprise to anyone here that self-compassion and self-care are really important, particularly for care partners. There was a recent study that looked at all of these different articles that measured self-compassion and self-care in care partners. And they took all this data and put it together. And across these studies, they found that care partners who had greater self-compassion, who engaged in more self-care behaviors, had lower burden, they had less risk of burnout, they engaged in more healthy coping strategies and engaged in fewer unhealthy coping strategies. They had better mental health. They had more confidence in themselves as a care partner. And they also had greater vitality. So there was a physical health component to this as well. And I think one of the most common analogies that I hear when people are talking to family care partners is about the mask on an airplane. You put the mask on yourself so you're able to assist somebody else. I think that's really true. And it's also something that everyone here has heard before, I'm sure. And I think we heard this in Carrie's presentation as well. We have 2 speakers here talking about the importance of taking care of ourselves. So we know that this is a really vital concept and component to being a care partner. And it's something that is really hard to do and something that we often don't do. And I'm curious now if we can think about what are the barriers to being compassionate to ourselves, to engaging in self-care behaviors, really taking care of ourselves as the care partner. What are the barriers? What gets in the way of that? Does anybody have any thoughts or want to share what they think?
Well, for one, you feel like you're leaving the person that you're supposed to be taking care of to take care of yourself, and that feels selfish.
Yeah. Thank you for that. We often, there's a term of like guilt about taking care of ourselves. It's like a whole concept that a lot of care partners feel. And this really varies for each individual. Everyone's going to have different things that get in the way of this, and people are going to be at different places with things like self-compassion and self-care. Lack of time, yeah. So I put down some thoughts here, and again, these are just things that I've observed in my practice with care partners, and it is going to be different for everyone out there. But going back to the first exercise that I had you do when thinking about what is the ideal family care partner, a lot of the responses were really rooted in this loving act that is selfless. And as you were just saying, that there is, you're there to take care of this other person. It feels kind of selfish to take care of yourself sometimes. And where's that coming from? So a lot of the responses, a lot of the images that we get of being a care partner from society is that it's a selfless act. And so, in thinking about, and this group is probably a little bit more advanced than a lot of the groups that we see, but it was still few and far between how many people's image of a model care partner was that care partner taking care of themselves and not, really being knowledgeable and able to regulate themselves to be the best care partner for the care recipient. And that gets in the way sometimes. When our schema, when our benchmark for what an ideal care partner is, that's handed down from the media, society, from our family, is that it's completely selfless, then it does feel weird to take time out of our day to engage in self-care, or to give us a break when we accidentally lose our temper or something. There's another component of this for the individual. So we're all raised in our own family culture, and that also shapes what it means to be a care partner and what it means to be a good care partner. So you might be the chosen one in your family who's always taking care of everyone and always put others' needs above your own. And so then it might feel odd to incorporate additional self-care for yourself. And those can get in the way sometimes. Other barriers, and some of these are reflected in the chat around just not having enough time, not having enough resources, finances. If you're in a rural community, how many organizations are out there to kind of bring in more of that physical help, limited social support, depression, pain, your own physical ailments and illnesses. can get in the way. And then I also want to highlight that there's two kind of big emotional barriers to self-care sometimes with care partners. And these are really strong emotions, and they're all kind of connected up here. The societal forces, the individual factors, the more practical things. But a lot of times love and fear can also shape how we view our own wellness in the context of being a care partner. So, I love this person. That's why I take care of them. Society, my family tells me that love is selfless, and therefore, I love them so much. I want to provide the best care. And in my mind, that's a selfless act. So that becomes the priority. Fear also of, what if I take time for myself and I do something, and I leave the house and my spouse falls, or they injure themselves in some way because I went out and did something. I'll never forgive myself. So there's a fear component as well that can get in the way. And, again, those are two very, very strong emotions that can dictate our behavior. And, I think that we all experience those to varying degrees. So I guess the question is, what do we do about that? We can theorize all day about what gets in the way, but let's come up with some practical tips. And so based off of what self-compassion is and self-care, and also some of the barriers that we see often with care partners, I wanted to share just 3 kind of key tips for increasing your self-compassion and self-care, which I think can be really important, especially now during the holiday season, and as we're going into more restrictions with the pandemic. So the first is schedule your self-care time first. I don't know how many people here make to-do lists. I am someone who would be lost without a to-do list, and I recently moved and I'm still setting up, and this week have actually been lost without my to-do list. So if that's something that you do, I would encourage you to schedule your self-care time first and have that be the cemented thing in your calendar and work around it. I'll share, in March, when we first went into the lockdown, I was really struggling to stay organized. I was working, just at the kitchen table, and wasn't going into the office, and just felt like I was having a really hard time with my own organization. So I watched a couple webinars, and what I took from them was this really great strategy of before the week. So on every Sunday night, what I'll do is I'll make a list of all the things I want to accomplish that week. All the work things, all the personal things, and this is like a very comprehensive list. So this is even writing down exercise, writing down spending time with family, all the things that I want to do this week, write it down. Then map it on to a calendar, and essentially create like an hour by hour for 7 days a week, 12-hour days, really everything that you want to do, schedule it down to that granular level. And the person giving the webinar said, and just know, you're probably not going to fit everything you want to do into the week. And so then you kind of get to choose which ones roll over, which ones just aren't that important. But not everything's going to fit. And I noticed that the things that I cut out were the things for me. So I said, well, I really want to get the edits done on this paper this week, and that's probably going to take me an extra hour. I guess I don't really need to go on that run. Or I guess I don't need to spend 3 hours on the phone with my friend. I can do an hour and a half. And it kind of sucked. I wasn't doing anything for myself for like a whole month. And, I was not feeling really great about that. And then a friend of mine said, well, why don't you schedule that in first and work everything around your self-care time? And I have to tell you, it worked amazingly, to the point where I don't know how this happened. It's almost like a magic trick. I didn't actually have to cut out more of my schedule when I was scheduling the self-care time first. Everything else just kind of fit in. And so if you can see my screen, I want to just try to demonstrate this in a different way. So here I have a jar full of rocks, and can everyone see me? I'm in the corner. So these rocks are different sizes. Some are big rocks, some are little rocks. And let's say this demonstrates all the practical things you have to do in your week, all the care partner tasks you have. It's a lot. You could fill up your week like this. So these are all the practical things you have to get done. And let's say a very important component is this self-care, which is this little brain here. And if I have all my things I need to do, and then I have this big chunk of self-care, doesn't fit. When I put in all the practical things and then I try to fit in my self-care, I maybe get a little bit, but not enough to make me feel complete. Let's say this is what I need to feel complete and well, and I can't do it. So I take it out, I just, go throughout my week doing the practical stuff. But what if in making my schedule, I put the self-care stuff in first, knowing this is what I need to feel good about myself. I put that in. And let's hope this works for... It all fits. I can close it. I couldn't close it before. So when you're making a schedule your self-care time first, and I think you'll be surprised at how well other things can kind of fit in with that. The other component, another tip, is to practice mindfulness. And Carrie talked about this a little bit, and I wanted to just do a very, very, very quick exercise. So on your piece of paper or in your Word document, I want you to just take an inventory of where you are right now, where your stress level is, 0 through 10. So 0 is you are completely calm. You're essentially lying on a cloud right now. You're feeling really good. You're loose. You're happy. 10 is you're really, really stressed. Your muscles are super tense. You're very, very anxious. This is the worst anxiety you've had in your life. So 0 through 10, what's your anxiety level? What's your stress level right now? So write that down. And then find a comfortable seated position and just notice your breath. Don't change anything. Just notice 3 breaths coming in through your nose, circulating around your body, out through your mouth. Again, you're not changing anything. Just notice it. Just notice the air coming in, the air coming out. And then turn your attention to the room that you're in and name 5 different things you can see. Try to get really granular about it. Are these things that the light is hitting? What's the color? What's the texture, the design? Just notice one thing and then move on to the next. And just notice 5 different things that you can see in your environment. And now bring your attention to touch and notice 4 different sensations that you can touch. It might be clothing, it might be the chair or sofa or throw, your computer, but just touch 4 different things. Notice the texture, the temperature, and then move on to the next. 4 things you can touch. And now notice 3 things that you can hear in your environment. It might be a noise from outside, could be my voice, could be a pet. Usually I have a cat screaming that we can hear, but so far so good. What are 3 different things you can hear? And now bring your attention back to the room, to me. And do the same thing as you did before. Print 0 through 10. 0 is the least anxiety, 10 is the most anxiety. Where's your stress, where's your anxiety level now? And so that was about 1.5 minutes, maybe 2 minutes that we did. Really simple. Didn't involve any fancy maths or prompts or anything like that. Just changing our awareness, our attention to the present. And even if you moved from a 6 to a 5, a 10% reduction in anxiety for 2 minutes, I'll take that. And so that that's one really quick, easy mindfulness exercise that you can do pretty much anywhere. And the reason why that works so well is we're really not that good at multitasking. And when we're flooding our brain with all of this sensory information in our environment, when we're really focused on that sensory input, it's hard for us at the same time to go on these anxious thought cycles, to ruminate about the past, to feel those depressed thoughts, and where our brain is really focusing on garnering that sensory input. So that's a really quick mindfulness exercise to try. The last tip that we can do for increased self-compassion and self-care is noticing some of those self-critical thoughts that are really the antithesis of self-compassion. So the thoughts like, I should be doing blank. I did this, so therefore I'm a bad care partner, I'm a bad spouse, a bad child. Each one of those thoughts is essentially creating a bar and almost imprisoning you to engage in things like self-compassion and self-care. So noticing those, recognizing what those thoughts are for you, where your self-critical thoughts kind of come in, what are the content of them, and then challenging them. And how do we challenge thoughts? It's 3 kind of key ways to address some of those self-critical negative thoughts about yourself. One is to check yourself. Is this how I talk to or treat a friend? Is this, am I not engaging in that self-kindness that I talked about earlier? Am I being hypercritical of myself? And would I even talk to a stranger this way? One thing that I find really helpful is coming up with some canned coping statements. So a lot of times these negative self-critical thoughts are making generalizations that really aren't true. And you can probably come up with some evidence against these negative thoughts. So I'm a bad care partner, for example. You might come up with a statement, no, my spouse is so grateful for me, or whatever the statement is that would counteract some of these self-critical thoughts that come up pretty often for you. And it can be, I'm not alone, people are imperfect, I deserve the same respect I show others, I'm a good husband, wife, child, sister, brother. Thinking about what are some of those statements that I have ready for when those self-critical thoughts come up, that I can use them to as a counter argument to challenge the validity of those. And the last component is, we don't really get to judge ourselves. We're not qualified to make judgments about who we are as people or care partners. Yet we do that a lot. Our role with ourselves is a lot more akin to an investigator, a detective. So when we're having these negative self-thoughts, when we're being hypercritical and coming up with these challenges to being compassionate toward ourselves or to engaging in self-care, really try to let go of that role of the judge and be more of that role of the detective. So think about, why am I being critical? Is this a societal norm or a personal standard that I've set for myself that's unrealistic? Am I feeling a lot of fear? Am I feeling a lot of love? What's going on that's leading me to talk to myself in this way? And again, we're a detective. We're not a judge. A judge says, you're a this. It's more complicated than that. We really need to do a lot more detective work for ourselves. So this week, this month, I would encourage you to think about, in these domains of these categories, which one speaks to you in a sense, like, oh, I could benefit from that. If it's, not implementing enough self-care, if it's, that you're, sometimes get really stressed out and need to bring yourself down for the mindfulness. Is it, the negative self-thoughts? Pick at least one and see if there's a way that you can incorporate it into your week. And this stuff doesn't take a lot of time or money. Even scheduling self-care, we're not talking about going on a cruise. It can be, finding, watching your favorite show or listening to your favorite album in a different room. But scheduling that prior to all the other things in your week. And that's about the time that I have. I want to thank again everyone for their attention, their time, and hope everyone has a wonderful Thanksgiving, albeit